Zara is a fictional character, but what they went through is happening across North West today. This is their story. In Blackburn, one of the most deprived constituencies in England, healthcare workers are desperately needed while training places sit empty, and people who want to become nurses are told there is no funding for their courses. This is Zara's account of what happened when she tried to train as a nurse in a system that treats public investment as a cost rather than the means to deliver care.
I'm Zara, and I've wanted to be a nurse for as long as I can remember. Growing up on the Shadsworth estate in Blackburn, my mum worked nights cleaning at Royal Blackburn Hospital. During school holidays, I'd sit in those hospital corridors, waiting for her shift to end, watching the nurses work. Even as a kid, I could see they were the ones who made the difference. They were the ones who held someone's hand when they were scared, who noticed when something wasn't right, who made people feel human when everything felt clinical and frightening. I'm dyslexic, which made school harder than it should have been, but I found ways around it. I got good A levels in biology and chemistry because I was determined. I knew exactly what I wanted to do with my life. I was going to become a nurse, work at Royal Blackburn, and be there for people the way I'd watch those nurses be there for others. In 2019, I applied to the University of Central Lancashire for adult nursing. I got accepted. I was over the moon, but I needed to defer for a year to save money, so I planned to start in 2020. When I applied again, I got accepted again, but this time they told me something different. The cohort was being reduced due to budget constraints from Health Education England. They couldn't take as many students as they had places for. I didn't understand it then. I thought maybe they just didn't have enough lecturers or something. So I waited and applied again in 2021. Same response. Budget constraints. I started working as a healthcare assistant at Royal Blackburn Hospital while I waited, thinking maybe the experience would help my application. What I saw there opened my eyes to something I hadn't expected. Every single shift, we were understaffed. I watched qualified nurses run between wards, staying late, missing breaks, because there simply weren't enough of them. I watched patients wait longer than they should have because we couldn't cover everything. And I thought, if they need nurses this badly, why aren't they training more of us? In 2022, I decided to go straight to the source. I contacted Health Education England Northwest directly. I explained that I'd been accepted twice, but couldn't get a funded place. The person I spoke to was polite, but clear. Training places are limited by Treasury spending allocations. There is no additional funding available. I accepted that at first. It sounded reasonable. Of course, training costs money. Of course, there are limits. Everyone accepts that. But then I started noticing things that didn't fit. I went back to UC LAN to ask about other routes into nursing. The lecturer who showed me around took me through the nursing building, floor after floor of simulation labs, all the equipment you'd need to train nurses, sitting empty. I asked why. She said, "We have capacity for twice as many students, but we can't get the funded places." That's when it hit me. The building was there, the equipment was there, the lecturers were there, the people who wanted to become nurses were there. I'd met some of them, people from my own street who'd applied year after year and been told the same thing I'd been told. But someone in Westminster had decided that the government that issues the pound couldn't find enough pounds to connect these people to this training. I started to see the contradiction everywhere. In the hospital where I worked, there were whole wards that could have been open if they'd had the staff. The beds existed, the equipment existed, the patients who needed them existed. What didn't exist was the political will to spend the money that would train the people to staff them. I finally got onto a course in 2023, but only because 2 other students dropped out at the last minute. I was lucky, but luck shouldn't be what determines whether someone can train to do the work their community desperately needs them to do. I used to accept the excuse that there was no money. I hear it differently now. The government that prints the notes and mints the coins told me it could not find enough of them to train the people who were standing right there, ready to work. The real question was never about money. It was about whether the people existed, whether the skills could be taught, whether the facilities were available. They were, all of them. The excuse was not a fact. It was a choice wrapped in the language of impossibility. It is the same logic as a household that says we cannot afford it, except a household does not issue its own currency. The government does. The limit was never the money. The limit was the willingness to spend it into the places and the people who needed it. I'm in my 2nd year now, and I love every day of it, but I look around my cohort and I think about all the people who should be here with me, who wanted to be here, who tried to be here, and who were told there wasn't room. There was room. There were empty labs, available lecturers, and hospitals crying out for more nurses. What there wasn't was a government willing to treat training nurses as an investment rather than a cost. This isn't just my story. It's the story of every constituency where people and needs exist side by side, while someone in Westminster says the cupboard is bare. The cupboard was never bare. It was locked.
What Zara experienced has a name: fake experts. Think about how tobacco companies used to cite scientists who claimed smoking was safe. They found experts who would say what they needed them to say, then repeated those claims until they sounded like established fact. The key was finding someone with credentials who would ignore the overwhelming evidence. The same technique operates in healthcare funding. When Zara was told there was no money for nursing training, the policy was backed by economists who treat the government budget like a household budget. They cite these experts as though repeating the household analogy makes it true. These fake experts ignore the fundamental difference. Households do not issue their own currency. The UK government does. It does not need to find pounds before it spends them. The real constraint is resources: people, skills, materials, time. And in Zara's constituency, those resources were sitting idle. The objection economists say we cannot spend more on health without causing inflation is a perfect example. Which economists? The profession is divided. Many macroeconomists argue the binding constraint is real capacity, not currency. Economists say, without naming them, is an appeal to unnamed authority. The resources existed, the people existed. The decision not to connect them was political, not financial. Blackburn ranks 15 out of 543 English constituencies on the English Indices of Deprivation 2025, placing it in deprivation decile. 1. The constituency has 373 registered charities according to the Charity Commission Register. Total grants received amount to £5.1 million according to 360 Giving Grant Navi. All sources are published at blockedbritain.co.uk. Blocked Britain tells the stories of people whose lives are shaped by the gap between what Britain needs and what its institutions choose to provide. Every character is fictional, every situation is drawn from official statistics. Produced by Blocked Britain.